Very good morning. I'm Dr. K Dhanadivya. My topic for presentation today is concentrated growth factors in reverse tunneling technique, a new hope in treating gingival recessions. Gingival recession is a common clinical finding in periodontal disease, which is frequently associated with aesthetic concerns, root hypersensitivity, and root caries. And that brings us to the definition of gingival recession, which is the displacement of marginal tissue apical to the cemento-enamel junction, according to the American Academy of Periodontology in the year 1992. The classification of recession defects was given by P.D. Miller in the year 1985, which states that class 1 is marginal tissue recession, which does not extend to the mucogingival junction and it is not associated with the alveolar bone loss in the interdental area. Class 2 is marginal tissue recession, which extends to or beyond the mucogingival junction and is not associated with alveolar bone loss in the interdental area. And class 3 is marginal tissue recession, which extends to or beyond the mucogingival junction, and it is associated with alveolar bone loss in the interdental area. Whereas class 4 is marginal tissue recession, which extends to or beyond the mucogingival junction, and it is associated with gross alveolar bone loss in the interdental area with the exposure of more than one proximal root surface. Now, according to the American Academy of Periodontology, AAP position paper in the year 1996 on mucogingival therapy, aesthetic demands, reduction of dentinal hypersensitivity, and management of root caries or cervical abrasions are the indications for root coverage. And one of the most predictable procedures for gingival recession is the management by using a coronally advanced flap with subepithelial connective tissue graft. But owing to the second surgical site, which is a donor site, and a difficulty in procuring a sufficient graft in cases of multiple recessions, various alternative techniques and additive membranes are being used. The various techniques for root coverage are free gingival autograft, pedicle graft, subepithelial connective tissue graft, which is actually the gold standard, and the guided tissue regeneration and pouch and tunnel techniques. Talking about tunneling techniques, there are a lot of variations in the tunneling techniques, where it was given in 1985 by Radsky, which is the envelope technique, and Allen in the year 1994 came up with the original tunnel technique, and Ezzy and his co-workers in 1998 gave the coronally advanced tunnel technique. Mann in 2001, he gave the modified tunnel with cellular dermal connective tissue graft, and Cottinelli and Tonetti came up with the microsurgical tunnel approach. Now, Reginato et al. In the year 2017 came up with the alloderm reverse tunneling technique, and this case report is based on that. When I talk about reverse tunneling technique, this technique was actually based on ART, or the alloderm reverse tunneling technique, which was given by Reginato in 2017. This technique combines the aspects of sulcular manipulation of the gingiva and vestibular tunneling to facilitate access, improve tissue mobilization, and create ease of graft insertion without harming the overlying tissues. Now, this bidirectional tunneling of the gingival tissues is done to improve tunnel creation, tissue mobility, and graft insertion while minimizing nicks, tears, and perforations of the free gingival margin. A single papilla may be incised at the farthest point of the surgical region to accommodate the width component of the graft through the first gingival sulcus. Now, the advantages of this technique is that it's a minimally invasive method, and it has better access for pouch creation, tissue mobilization, and graft insertion is with use of an alternating incised papilla design. Now, but the limitation is that among smokers, there is a higher risk for impaired wound healing and graft necrosis and infection. In our case report, the addition of concentrated growth factor as a graft material has been suggested, or it has been used in order to accelerate soft tissue wound healing, promote revascularization of the surgical wound, and facilitate patient recovery. Now, this concentrated growth factor is an autologous platelet concentrate, which is developed by Sacco in 2006, and it is obtained from blood samples through a simple and standardized separation protocol without the addition of exogenous substances. Now, the main feature of CGF resides in its consistency because it is an organic matrix rich in fibrin, which is able to trap platelets, leukocytes, and growth factors, which are the key elements and they play a vital role in regenerative process. So this shows better regenerative capacity and higher versatility when using the fibrin-rich block. Now, the CGF in general uses a variable centrifugation to separate cells in the venous blood, resulting in a fibrin-rich block that are much larger, denser, and richer in growth factors. So this altered centrifugation procedures provides us with a denser and richer fibrin matrix containing growth factors. Now, the tube are centrifuged at a one-step centrifugation protocol, 30-second acceleration, 2 minutes of 2,700 RPM, then 4 minutes of 2,400 RPM, again 4 minutes of 2,700 RPM. So this varied or variable centrifugation to separate the cells results in a fibrin-rich block. And the different phases of CGF are the superior phase, which is the serum, interim phase, which is the fibrin buffy coat, the liquid phase, which is the growth factors, and the lower phase, which is the red blood cells. Moving on with the case report, a 43-year-old female patient who was systemically healthy reported with a chief complaint of sensitivity in relation to her upper anterior teeth and receded gums for the past 6 months. On clinical examination, it was revealed that she was diagnosed with the Miller's class 1 recession, and the preoperative parameters were evaluated, like the recession depth, the probing depth, and the clinical attachment level. Now, the incisions were placed after application of the anesthetic agent at one end of the papilla. With the help of a Hugh-Freedy tunneling knife, a tunnel is being created with all the papilla intact throughout the extent of the recession. Now, the smooth, dull working edge of this instrument reduced the risk of perforation during our tunneling procedures. And the term reverse tunneling implies performing the flap dissection in the opposite direction in the context that it is either being compared to the sulcular or the vestibular tunneling methods. And the maximum access to the subgingival environment through multiple entry points allowed for optimal navigation through challenging biotypes and non-uniform bony architecture and around anatomical limitations within the surgical region. Now, the graft material was inserted through the tunnel, and as mentioned, the single papilla incised at the furthest point of the surgical region helped to accommodate the width component of the graft through the first gingival sulcus. Then the sutures were placed, hemostasis was achieved, and Copac was placed. Now, this is a 15 days post-operative image, and the second review was done 3 months post-operatively. Now, there was difference in the clinical parameters post-operatively, and this is a comparison between the pre-op image and the 3-month post-operative image, and the comparison of the pre-operative and the post-operative clinical parameters, where it showed significant difference. Now, moving on with the discussion, Arroka et al. In 2010, he treated about 20 patients with multiple Miller's class 3 recession in a randomized controlled split study. And in that case, they had used a modified tunnel approach to insert connective tissue graft with and without enamel matrix derivative. And the authors demonstrated that CTG is a predictable method where they found root coverage was about 82% when used along with EMD and 83% when CTG was used alone. And apart from that, Modarasi and Wang et al. In the year 2009, they did again a study on 5 patients with multiple recessions of class 1 and class 2, where acellular dermal matrix was used instead of CTG for the tunneling approach. And Thalmeyer et al. Again treated about 8 patients with multiple Miller class 1 recessions using a modified tunnel technique, where 93.3% of success was obtained, root coverage was obtained, and it was stable even after 6 months. Now, it was seen that if the initial recession depth was less than 4 millimeters, complete root coverage was found in 84% of the cases. And if the initial recession depth was greater than or equal to 4 mm, only 44% could have been completed. Now, in our study, we had used concentrated growth factor. And as I had mentioned earlier, it is a fibrin-rich organic matrix, which contains growth factors, platelets, leukocytes, CD34 plus stem cells, and it helps in regenerating process. Now, this CGF releases various growth factors like platelet-derived growth factor, transforming growth factor, fibroblast growth factor, and all these factors help to stimulate cell proliferation, matrix remodeling, and angiogenesis. And studies have shown that CGF acts by degranulation of the alpha granules in platelets that contain growth factors which play a vital role in early wound healing. Apart from this, studies have also demonstrated that tissue adhesive with the hemostatic and where CGF acts as a tissue adhesive with the hemostatic and tissue sealing properties. It promotes wound healing and accelerates osteogenesis, improves the wound stability, and it acts as a scaffold supporting the cytokine attachment and cellular migration, and it acts as a carrier for growth factors. It possesses antimicrobial effects due to a high concentration of leukocytes, and it also has anti-angiogenic property. So to conclude, this altered tunneling technique is one of the many contemporary variations of previously described gingival grafting techniques. And the autologous concentrated growth factor is a relatively new biotechnology autograft that is evidently demonstrating a significant stimulation and acceleration of soft tissue wound healing and formation. So thus, as periodontists, surgical innovation is necessary and attempting newer techniques and refining our methods and materials in the area of periodontal therapy. And through this progressive manner, the field of periodontics will definitely continue to modernize and transform its treatment approaches for the benefit of growing patient population. Well, these are my references. Thank you for your patient listening. I would like to thank the organizers for the opportunity. Thank you very much.